Hello, and welcome to Fertile Minds. I'm Dr. Michael Flynn. I'm a fertility doctor with Queensland Fertility Group, based here on the Gold Coast. And today, I want to discuss all the concepts around possibly becoming spontaneously pregnant during the time of your fertility treatment. So first, look at the scenario of it's just unexplained infertility. We've been trying this for ages and there's no other reason not to get pregnant. And in that scenario, we would, as a fertility clinic, be over the moon if you became spontaneously pregnant. It would just be seen as great. Sometimes if we're doing intrauterine insemination, we're always asking you to have intercourse at home at the same time if we're able to do that. With ovulation induction, we're often still asking you to have intercourse at home as well as insemination in the clinic because it improves our chances. And both insemination and ovulation induction, we're specifically monitoring you and we will tell you if we think you've got too many follicles. We would tell you if your chances of multiple pregnancy are too high and to avoid intercourse over the next few days. So the real advantage of doing ovulation induction and intrauterine insemination through a fertility clinic is we're deliberately trying to avoid the risks and complications of spontaneous pregnancy with regards to things like multiple pregnancy. So as a general rule, no, I'm keen for you to try home intercourse at the same time as us doing fertility management with intrauterine insemination and ovulation induction. With IVF, it makes a little tiny bit of difference as to why we're doing the IVF. There's a lot of times we do IVF that we're doing pre-implantation testing of the embryo. If we're checking out the embryo to see if there is a genetic disorder, and that would definitely be the time when we would be telling you to avoid intercourse during that time. There are also very specific scenarios within IVF. We collect eggs, but we think we haven't collected the amount of eggs that we saw follicles. So the last thing we want to happen is for you to have a high-level multiple pregnancy. So having intercourse around the same time as IVF, or possibly a little bit uncomfortable because our ovaries are quite stimulated, can have some areas of concern at that exact month. No, apart from all what we were just saying, that the exact time we do IVF, the exact time we do an egg pickup, there's no reason on the months either side not to try and get pregnant. And we think that there is a benefit on that. It's interesting, during our fertility treatments on things like treating endometriosis, there's often a little spike of fertility just after treating endometriosis. So we're often hoping that you have a natural pregnancy just after some of our fertility managements. What do I tell my patients? Well, in summary, what we're getting to at the end is I want a baby. And any way we get a baby safely is the best way. I want them to have intercourse at home when we're doing intrauterine insemination. I want them to have intercourse at home while we're doing ovulation induction, specifically after we've made sure that there's not too many follicles and we've minimized the risk of multiple pregnancy. I'm probably not as enthusiastic about having intercourse at home on the night we do an egg retrieval because of discomfort to the woman, and there's still a possibility sometimes in some circumstances of multiple pregnancy. But all of our fertility managements are there to optimize you having a family, and if it happens, I'm going to be the first to say congratulations. Thank you very much for watching. Be sure to subscribe and keep up to date on all things fertility. Thank you.